healthcare professionals understand that uh, there's still the issue of asymptomatics and pre-symptomatics and people who have no idea what their COVID-19 status is. And there has to be some way to organize a testing scheme. Well, the mayor doesn't like the word scheme, a testing program to address address the people who've just simply been left out of the equation. And that's many of us, most of us, in fact. So we're hoping to get the people in the room who could begin to tell us uh, how we could work to get that particular piece of this puzzle taken care of. I'm sorry that I'm cutting away. People are joining and I'm admitting them. Okay. Okay. There are a lot of people coming on. So I'll just ask you to be patient with me for a little bit. Yeah, we have, as we speak, we have 15 people and more coming. Um, Mr. Sawyer, I understand that you're the assistant incident commander for Trenton. Is that the case?
Yes, sir.
Okay. Well, the incident commander would be the fire chief?
Not necessarily. So when you look at it from an emergency management perspective, your incident commander is the person in charge of handling whatever incident, whether it be this pandemic or whether it be a major disaster like flooding, Hurricane Sandy, whatever your incident is. Your incident commander is the one that's charged with mitigating that incident to its completion. So what happens is in the city of Trenton, the fire director also doubles as the emergency management coordinator. So each county has an emergency management coordinator, and then under them comes the city emergency management coordinators that's going to handle the incidents. So as you may be aware, all the funding for emergencies flow down from federal, state, county, and then local.
Um, a reason I asked the question was we're in a pandemic, and it would seem that someone with expertise in the health field would be the incident commander dealing with a pandemic.
Well, that would be perfect if you had somebody in health field trained in incident management.
Oh,
so when you talk about the incident management system or the incident command system is not specific to a title or position. It's really specific to a function. So your incident command system or incident management system or national incident management system, which would be operating under this because this is a national pandemic.
Right.
You have command, which is the incident commander. You have operations, planning, logistics, and finance. So all those functions comes under the incident management system. Now, if you happen to have a health officer or somebody in the health field that's trained in incident management, then that's the perfect scenario. But if you don't have a person trained in the incident management system, you can't just put them in there and say, well, I'm the incident commander just because I'm the health officer. It doesn't work that way.
Oh, I'm sure. But you pointed out what's the thing that we need to concentrate on. Someone in the health field needs to be trained to deal with a health emergency like a pandemic or an epidemic. If there's no one trained, then that's something that we need to explore at some degree, because you're right. You can't walk into the incident command system and know how to use it or even how it works.
So obviously, so you sound like you're making the assumption that hasn't been explored or approached.
I don't know. I asked you why wasn't
I didn't hear a question. I heard a statement. So if you're asking me the question, Yes, since I've been here, my goal has been pushed to train every single director in emergency management so that it can fulfill the roles better and more efficiently. So there's specific trainings that you need to take,
Mhm.
incident command or incident management system training that you need to take. And some of those trainings can actually be taken online. So since I've been here, I've pushed most of these directors to take some of the training. Some of them have, some of them haven't. So
Okay.
I'll leave it at that.
Yeah. All right. We'll leave it there, and I'll be sure to ask that question to the appropriate people.
Right.
I guess that maybe I should point out that I recently retired from the New Jersey Department of Health Laboratories, and while I was there, I served as the laboratory coordinator, chemical terrorism laboratory coordinator. So I had to be trained in the operation of the incident command system in order to operate laboratories and do the testing and the analysis in the case of a chemical attack.
Hmm.
And so I'm familiar with the overall structure of the incident command system.
Hmm.
And I was wholly expecting someone in this instance from the health field
Hmm.
to be more or less the person who was managing the health response. So hence my question about um, the, the fire department as opposed to the health department being the commander.
Gotcha. So part of the national incident management system, if you're aware, is based off of what you call a whole community approach. And when you have the whole community approach, that's where your health professionals fall in. So for this incident, we're partnering with the Trenton Health Team to make sure we have a healthcare presence in this whole community approach. So when you're handling an incident, it's not just me as the incident commander handling the incident. I have to
Oh
make sure
no,
I use
it's a
all the
whole, it's a whole
resources in
right.
the community to get this done.
Mhm. And I'm not trying to put you on the spot, sir. I'm just
I'm not. This is what I do for a living. So I'm not
okay.
on the spot. Trust
Okay.
me. This is
I'm just asking the question,
I'm trained. I'm trained to teach the incident management system.
okay.
I worked in the fire service for over 30 years. I managed major incidents and events such as Amtrak 188, which the anniversary was just yesterday, where we lost 8 people, 200 people were injured. I managed the Popal visit. So I've managed major incidents. So I'm not on the spot. This is what I do for a living.
Okay. Thank you. And by the way, um, I guess what I'm getting at is that um, from me as just now with my citizen's hat on now, as a Trenton citizen, um, I'm trying my best, my level best, to understand how best to, as a citizen, to approach this COVID-19 situation locally here in Trenton, to gather what information I can, to try to understand what's going on, and uh, and as a research scientist who's worked in the health field, I'm telling you, I find it difficult. So I know it's difficult for the layman, the average person, the average citizen in the city of Trenton to get their arms around it. And that's why I guess the basis for this call, what is the plan and how's that being communicated to the people? I sent around an email earlier. I hope everyone got it to follow up on the meeting invitation. And it kind of outlined some of the questions that were of primary interest um, to me, and I would suspect most other people as well, as far as a epidemiological response to the COVID-19.
So my
And
question would be for you is, you said you find it difficult to understand or grasp your hand. What is it about the incident that you're finding, or not incident, but what is it about the COVID-19 issue that you're finding difficult to grasp or get your hand around?
I'm completely computer literate, but I got to go to a lot of different places
Right.
to find specific information to train.
Right.
They've done a fairly good job at the uh, uh, COVID-19 summary dashboard.
Right.
I see some information there, but that's still on the county level. Does it get down into Trenton specific? And then because it's so general, it still doesn't give me any kind of guidance. Number of deaths, and by the way, that was off. It was 19 for a while, and then it blew up into a larger number because they began counting the deaths at the nursing homes, which hadn't been part of it.
It's still
But
not part of it.
well, there you go. So
Well,
do
so
I
then
have clear information?
so that
Uh,
so what I would prefer is to ask the question so we can give you a response. So the reason why the deaths are counted separately than the nursing homes, because all the deaths that are in the nursing homes aren't necessarily Trenton residents. So the nursing homes report to the state reports to the county reports to us, and all those nursing home deaths aren't necessarily Trenton residents. So the nursing home deaths are counted separately. So there's 46 deaths in nursing homes that's tracked on the state website. Another reason why we don't report the nursing home deaths specifically is because we don't have jurisdiction over the nursing homes.
I understand.
They're mandated by the state. So we've actually had conference calls with them and try to develop that relationship so we can get that information, but they're not always forthright or forthcoming or honest. And we're not going to take information that's not straight forth and right and incorporate it. So we have a separate counting for the nursing homes, and we have a separate counting for the deaths we know there are Trenton residents that are reported through the health officer.
Well, you just pointed out, and we're all familiar how you can play with statistics to tell the story that you want.
That's true.
Obvi- Obviously, they don't want the city of Trenton to be aware of exactly how bad the problem is in their midst.
Who's they?
The nursing homes, for one, they're in business
I agree.
and they're hiding the fact that they have an outbreak. And I'm going to tell you why I'm so concerned. My
Mm-hmm.
sister and my niece work at the River's Edge,
Mm-hmm.
and they told me they weren't even informed. I had a friend come and tell me his father died there, and they
Mm-hmm.
didn't even tell him. And this little gimmick about, your official residence is in Trenton. You died in Trenton. That's a Trenton death. Now they can play games about what residence that person is last listed at, but as a resident of Trenton, I'm in danger, my family's in danger, and they're hiding the information.
Mm-hmm.
So that is what animates my curiosity about what's going on in Trenton. As we as Trentonians, and this is another thing that's going to go before the legislative body, we should insist that anybody dies in Trenton, that should be reported, particularly in case of a pandemic. That should
Mm-hmm.
be reported. And yes, we share the information with whatever authorities, but no nursing home, no business, no store should be able to have an outbreak and then they hide the information by playing statistical games. See, because that's my sister whose health is threatened. She could bring that home to me and my family. You
That's right.
understand? So these are the things that, like I said, I'm trying to organize myself so that I know how to protect myself and my family. This is not an abstract concept.
Mm-hmm.
My sister is taking chemotherapy. Okay, high risk. I got a 2-year-old grandson, and I just mentioned my sisters and my niece. My brother lives here, and I don't want to go on because I think we have a lot of people on the line, and I don't want to spend a lot of time um, uh, scoring anyone's ox. That's not what this is about.
Mm-hmm.
But the nursing home situation that allows that kind of a thing is something that Trentonians need to address on the legislative level. We have to pass an ordinance or whatever we need to do to make sure that institutions like that are not allowed to hide information that's of public health import.
Right.
And that's why I'm asking about where's the health department in this discussion. Now, I
Mm-hmm.
don't want to go again. I'm not interested in going anybody's ox. I just want to, as a citizen, find out. Let's get the information together. Let's have
Mm-hmm.
a plan for what's going forward
Mm-hmm.
and how that's going to be implemented. Because on top of that, we want to know as citizens, how can we help? You're going to need contact tracers. You're going to need outreach groups. You're going to need people to help communicate whatever this plan is to the general public in our local areas. So
Mm-hmm.
we have a role in it as well. So I'm just suggesting that everyone who has a role needs to organize ourselves in a fashion that's going to be most effective for the people in Trenton.
Mm-hmm.
And going online is fine for a person like me. But I
Mm-hmm.
can tell you in our community, that's rare. Not everybody is computer. We have a digital divide in our community. And putting it on the internet doesn't necessarily reach the masses of the people in the way that it needs to.
So how would you suggest we
Well, one of the good things happened. They've now included text, phone text, as a means of communicating with more people. And quite frankly, a lot of our people are very visual. I mean, they want it on paper. They want it written down. It's something they can hand and they can read at their leisure. Nobody's produced anything like a flyer. We see a flyer once in a while, but that's just one event, for lack of a better term. But I'm glad Mr. Paulson is on here. I would ask him if he wouldn't mind to kind of update us as to the state of the resources as it stands today regarding Trenton. Are you getting me, Greg?
Sure. Yeah, and I think, first of all, these conversations are really important because we spend a lot of time talking about how do we get accurate information into the community. And one of those ways is person-to-person conversation. So as much as we can make sure that people on this call have the right information, everyone can talk about it to other people. Let me also make clear what Trenton Health Team's role is, right? We're a nonprofit based right in downtown Trenton. We provide a bunch of services ourselves. We don't do a lot of direct health care, but a lot of what we do is be the organization that brings together all of the different organizations in the community that help keep the community healthy. So that's the 2 hospitals, that's Henry J. Austin, and thank you, Dr. Evans, who's their Chief Medical Officer, for spending time with us tonight. That's the City Health Department. That's a lot of other organizations that deal with things like food access, shelter, things like that are all part of being healthy. So what we've been working to do, as we've been hearing, just as you were just talking about, all of the gaps of information. And frankly, as you drive around Trenton, walk around Trenton, we see that a lot of places this is not real yet. Or it's not real to the extent it needs to be. And that makes a lot of sense for how a lot of this started, right? The initial messages, now it seems like a lifetime ago, but a couple months ago was stay away from people who've traveled to China or traveled to Europe, right? That is not a message that resonates here. And then I think as you and I were talking about when we spoke a couple weeks ago, right? We know even some messages from some hip hop artists in Atlanta who were saying, this doesn't infect Black people. And so the Black community is saying, no, I'm immune to this. Those messages, even though we know that they're wrong, persist. So we've been spending a lot of time trying to address that. We've been working with Latino merchants. We printed a couple thousand flyers in English and Spanish and sending those out. We've been trying to keep a lot of that stuff. The best way we have to distribute information now is on websites. So one of the things we tried to do is like post blanks of flyers that people can print. But it's tough. And our big focus right now, the most important thing, and I know we want to talk a lot about testing, but the most important thing we're focusing on is getting the word out to people for how to protect themselves and their family members and their loved ones around social distancing and wearing a mask. And as we're starting to next week talking about, there's starting to be little bits of opening up. The weather's getting nice. We all want to go outside. And, that's where we're going to see trouble. And we know the hospitals, they're keeping up. They're doing an amazing job. Henry J. Austin's done an amazing job trying to pivot to offer support remotely, via phone or computer. There are a bunch of places in the community where people can go if they don't have access to a phone or computer. But all of that's not going to work if everybody doesn't understand how important it is to stay distant from one another. We don't know who's positive. We don't know who's carrying the virus. And as much as we'd like to do, this is certainly something that is worse in Trenton and communities like Trenton, right? This has shone a bright light on a lot of the inequities in our community and others that have been there for a very, very, very long time. But we as a country don't even have enough testing resources yet. So we have to do things that are hard. We have to assume that other people may be infectious that we don't know yet. And we just don't have good ways to measure that yet. Even if Trenton was the place in New Jersey that had the most tests of anywhere else, it still wouldn't be anywhere near enough for us. We talk just about every morning with the hospitals and Henry J. Austin and Director Sawyer from the city. And, we're trying to keep track of how the hospital's doing overnight, how many patients are they seeing, how many are positive and presumed positive, how many are on vents, how many discharged, how many died, kind of tracking all that stuff. And we're seeing things getting better. And the hospitals have done an amazing job keeping up, but we're at a pretty fragile place that if we start getting complacent, that we're going to slip back. And that's the thing that I think if I had one message that I was trying to get out to everybody, it would be that. It would be take this serious, stay home. If you have to go out, wear a mask, stay apart. There are a bunch of ways to make that supportive for people. But that to me is the most important thing we can all do, because we're going to be at this for a while. This is not something that's going to be done next week. And I don't want to, I'm rambling a bit.
No, you're great. And thank you for what you said. But just an idea. What do you think of a Trenton Health Handbook? That we had a number of those printed with the standard contact information and then somewhere a report card, at least yearly, Trenton Health report card that every Trenton household would have, with all the numbers and contact information for each kind of incident, CBNRE incident, have a tab for each one of those, and what to do, where to go for food, where to go for shelter, what happens if the lights go out, who do you call? What about something like that every Trenton resident, almost like a phone book for Trenton services, was produced?
It's such an important thing, right? Knowledge of the resources that are available. We've spent a lot of time building kind of new digital systems for that, because the problem with anything printed, as soon as you print it, it's outdated.
Yeah.
Right. And so that's the biggest challenge. We actually, Michelle is a Trenton resident, our communications director. She posted a link in the chat to a page on our website. We have a list of food pantry resources linked there, food pantry and other meal sites that our staff are updating daily, because what people are doing is changing daily. So it's a tough call, right? We know not everyone has access to the internet or a computer or the internet, but we know as soon as we print it, something's going to be wrong. So it's, I don't have a great answer for you, other than I would hope that, and this is, we spend a lot of time talking to the faith community. I don't know everyone on this call. I know there are a lot of connections to faith-based organizations and a lot of other kind of community leaders. For people who don't have access to the internet, the most important thing is the other community leaders. And I'm not a Trenton resident. I want to be very upfront about that. But the people who are leading the community, get this message out. And if someone needs something, someone with access to the internet or a place where they can go to get access and get this stuff. So I agree with you. I'd love to kind of print something, but I just hesitate because it changes so quickly.
Well, guys, let me step in. This is Keith Crowell here. I'm a bit concerned about communication efforts. I know that the county has some effort. I get these drips from the county saying there are 19 new cases today, but we all understand that folks don't have access to the internet. We have WPVI studios right here in the city of Trenton. Why can't there be a local effort, either driven by the county or the federally qualified health center or some community-based organization, to do a daily or a weekly update on what's going on in Mercer County? I would be very surprised if someone contacted WPVI and said, we want to do this, and they would say no to that. So let's give that some thought, or something along that line. I think the point is we have to figure out ways where we can get this information to folks as quick as we can. That's one suggestion that I would have. And I'd like to have some thoughts on that in terms of communication on a daily basis or a weekly basis, something that could go live. The other thought is, I think there needs to be a more robust way of doing testing here in the county. And how do we get those tests to local folks? We need to go to where people live. They're not going to come to us. They don't have access to get to us. They're not going to walk to Henry J. Austin. They're not going to walk to a hospital. We could mobilize or contact CDC, get some funds, write for grants. There's supposed to be $500 million coming to the state of New Jersey. They could purchase vans, one for each of the wards, north, south, east, and west. And you can go to people and ask people to take these tests. Again, I would be very surprised if folks knew that they could walk, a couple feet and get tested, they would not do that. So We need to explore ways where we can get the tests to folks. They're rolling out rapid testing a lot more now. At least our president says that. We've seen.
Don't believe that.
They say that the rapid test is available. We need to explore ways of having a more robust testing program here in Trenton. So I think we need to talk about those two things. Daily communication. What is the incidence and prevalence here in New Jersey? I mean, in Trenton. And I think everybody understands what's going on in New Jersey as a whole. But I'm more concerned about Mercer County, Trenton in particular, because of the density. We all know the issues associated with density and incidence and prevalence. So we need more testing and we need better communication. That would be my focus. And I think we need to roll in community-based organizations, particularly the churches.
Yeah.
So, Greg, you want to address the test, or you want me to address that?
I can. I think Dr. Evans had something to say too, but I can, talk about with the testing that's happening right now. And so why don't I do that? And then Dr. Evans, maybe you talk, because we've been talking, like I said, every morning about how do we expand this. So the testing that's happening right now is being run by Mercer County Emergency Management. They have a contract with BioReference Labs to process up to 240 tests a day. Our role in that is we ended up providing the data system to allow them to track all of this, register people, receive the results. And we did that with the agreement that we would help them get started. They opened the Quaker Bridge drive-up site first, primarily because it's the safest way for everybody to stay distant from one another. But we only agreed to do that when they said, as soon as we get Quaker Bridge stood up, we're going to do walk-up sites in Trenton. And so those have been live. There's one in each of the wards, 1 day a week. So it rotates Monday, Tuesday, Wednesday, Thursday in the wards, usually in a church parking lot. What we've seen is we typically see 10 or so people a day come to the walk-up sites. And so overall, the testing, and they can do about 30 a day. What the county is running at right now is around 170, 180 tests a day total when they could do 240. So we have capacity to get those tests, and the results are coming back next day. But that process is not ideal because in order to get tested, you got to see a healthcare provider who's got to order the test. And then the test has to go to the county. Then the county calls the patient schedules, gets scheduled for test. So that multi-step process, which is pretty common, except in a couple of the other sites, is not satisfying for people. You want to get tested. You want to know now. And as you said, first of all, you have to walk. Even if it's in the ward, you still could be an unwalkable distance away. And there's a couple steps involved in terms of timing. So we've been working really hard on what's next, because we don't yet have the capacity to do population level testing, or even, the step in between that is really focused testing in certain subgroups, like one of the senior high rises or anywhere else where there's extra density and where there could be a case or, potential based on contact tracing that people should get tested. So Dr. Evans, do you want to talk about kind of what the thinking is there and what we've been kind of advocating for? But I again want to say this is right now, that's a county effort, and it's kind of set what it's doing. So we're pushing, the governor yesterday, I think, said there was going to be more state testing resources allocated to cities, and he listed Trenton by name, but we haven't heard what that is yet or what that means. So Dr. Evans, do you want to say anything else?
Yeah, I think such excellent points. And we've, again, on our daily calls, been talking so urgently about that need to expand testing. When we start hearing about opening things up at the state, federal, local level, it makes us very, very worried, because we don't have the information we need to make any of those decisions. And until we have that broader access, we simply won't. On the other hand, I really wanted to speak, since Greg really, I think, did a good job of painting what the current testing landscape is, I wanted to speak to that communication piece and to say, first of all, we do have access to testing even right now that isn't being used. And we would appreciate your help in spreading that word. It's a question of just reaching out to your primary. And if you don't have a primary, reach out to Henry J. Austin. And I've been speaking at every Zoom, Facebook event I possibly could to try to get that message out there. We've had, as we mentioned, community partners out in the neighborhoods, handing information out in English and Spanish. Our community health workers are doing a lot of community outreach. I've been on radio spots and TV spots, but it's just hard. We've done social media ads, but it's hard to get all that information out there. And then the next piece is it needs to continue and it needs to be constant because just as you're saying, things change from minute to minute. And so right now, we want everybody to know they can get a test if they have any symptoms, but we also want them to know we're hoping to expand that access as soon as possible. And we want people to be able to check back in, keep asking questions. The landscape keeps changing. We're getting new answers and new understanding about this virus all the time.
But doctor, let me ask you, why is the test physician driven? For example, I live in Burlington County. I'm part of the COVID-19 team there in the county. I work at the call center. You could call without a physician or a script. If you meet a certain criteria, we automatically schedule you for testing.
Mm-hmm.
So I'm trying to understand why in Mercer County, or particularly in Trenton, why is it physician driven?
Well, I wasn't obviously part of any of those conversations because that was set up at the county level. But when there is a site that doesn't have the requirement to see a physician, there's always an order by somebody somewhere. And so different counties, different testing structures chose different processes. I wasn't obviously in the decision-making pieces of any of that.
So
Okay.
I was not either, but I came
Can
in.
I follow up on that? Because
yeah.
This is a major barrier.
Yeah.
And it's something that
Oh,
really
yeah.
needs to be addressed. A lot of folks don't even have a doctor.
Right.
They can't even name a doctor.
Not insured.
And if they wanted to go to the federally qualified health center, you still have to have an appointment to see a doctor.
Right.
So this is a major barrier.
Oh, absolutely.
Which Burlington County got rid of because we recognize this. So I'm really having trouble understanding. And I'm not blaming the doctor or the federally qualified health center. I'm simply stating the fact. If that's a major barrier and we all recognize it, why can't you guys call the county executive and address this tomorrow morning?
Well,
Probably because we spoke with them yesterday.
I can't hear you. I'm sorry.
Your audio's cutting out, Dr. Evans.
Probably because we've been speaking to them every day and they tend to hear it from us.
Yeah.
Really,
we've been,
I just want to say briefly, please spread the word. To do what we can at Henry J. Austin to decrease those barriers, we've made it so that if you call and you think you need a test, we will get you a same-day virtual appointment and get you that order for the test. And if you have any challenges doing that, you can reach out to me directly. We've really tried to do the best we could to expand that access. And as Mr. Ward said, insurance can be a challenge if you're seeing a private provider, but the great thing about being in an FQHC is we don't need that piece. So please spread the word about that. Even within the limitations, which we all agree should be removed, we do have that ability. Go ahead, Greg. You were going to say something else.
Yeah, I was just going to say that the process for the county was set up basically 2 months ago, which was a lifetime ago. And we've been advocating about as hard as we can, like worried about losing my job advocating hard, because that's how important this is.
It is.
To get it changed. And we have not yet been successful. Part of it is there's a bunch of pieces missing from it that we haven't yet gotten enough answers for. And it's hard when the testing capacity that we have isn't being fully used. And that's, and there are good reasons why that's happening, because as this is a multi-step process, it's hard to navigate.
well, let me put it to you this way.
Please.
That's where us as citizens
Yeah.
can assist you guys, because if we prevail upon our county executive, Brian, who we know very well, particularly around election time, we can get some movement out of him on that. But that brings us back to the fundamental problem, and that's the rapid test. Now, I understand Rutgers is coming online with the saliva test. Have we applied to Rutgers, got in line? And then we're talking about the rapid antibody test. That's also coming online. And my problem is if we don't have a plan to utilize this and apply for the grants or whatever, we're going to be at the end of the line. So that's why I'm urging that we get out in front with saying, listen, we would like to do all of the Trentonians get ready to go back to school. What about the staff? What about the kids? All of that has to be in place before any parent is going to feel good about sending their kid to kindergarten. So we have to have some kind of testing operation conceived, put down in black and white, and apply for the resources to fund, even though all those resources may not be in place at the moment. But the promises have been made all up and down the line. They're coming. But we can't wait until they decide that my health is important. Only I'm going to be able to do that. And I guess that's what we're doing here tonight, to stir the pot, to get the healthcare professionals thinking about a COVID-19 testing plan for everyone in Trenton who wants one. We have vans. We have medical vans. I mean, we don't have to get any, but we have to schedule them, notify the people that are going to be there, inform them they're going to be there, have volunteers taking the information so that the medical professionals can just administer the test and not be bothered with filling out paperwork. But we can do that if we team up. But we have Rutgers is talking about saliva test. How cool would that be if we could get involved with that right there in Rutgers? And the serological tests and the Cepheid test, these are all things that are in existence. It's not like we got to invent these things. But if we don't have it written down, if we don't have a plan of action, this is not going to happen. And I get the feeling from the national leaders, they just wish this to go away. They just wish it to blow over. But as a member of the African-American community, I know that our people are suffering more than anyone else. And let me tell you something that disturbed me. Preparing for this meeting, I went to the CDC guidance for testing priorities, and they had members of the African-American Hispanic communities with underlying conditions as one of the groups that was on a high priority. I went there today. Guess what? They took it down, which says to me volumes. We're no longer a priority. So when I say, brothers and sisters, we are on our own, we are on our own. If we don't do this for ourselves, you cannot count on anyone to do it for us. So I'm sorry if I get a little passionate about this, but we're talking about the lives of my family, myself, and my people by extension. And we're appealing to you, healthcare professionals, to be our advocates. You got to go to bat for us. We're not on those calls. And we need you to push this idea forward. We'll back you up. We won't let you get fired. You know, we will back you up because you're going to bat for us. But you gotta buy into the idea.
Let me real quick before we move on. I wanted to address Mr. Crowell's other issue as far as communications. So just so that you know, the mayor and members of the Health and Human Services have been on WPVI and including other stations, and they've also printed and distributed more than 10,000 flyers in Spanish and English. So I want to make sure we address that concern of yours also. And back to the advocacy. I can vouch for every health professional on this call that I talk to every day that they have been advocating every day. We've been talking about this for a while now. How can we get to the next phase? Because we understand the initial phase was symptomatic testing. The next phase is asymptomatic testing.
Exactly.
We understand that. And I can vouch for everyone on this call. They have been advocating, and they advocate every single day. Go ahead, Greg.
You know, there are some things that we can't remove the barrier yet. Access to sufficient personal protective equipment, access to all of the things that are needed to run the test. Capitol has the Cepheid machine. They're running it at capacity, you know, and this is part of the issue with federal preparedness, is that we're just still playing catch up. But I agree with you that we need to keep putting the plans in place so that as the PPE supplies catch up, as the testing capacity catches up, we make sure that we are going live with those processes as quickly as we possibly can. We don't want to miss the opportunity to maximize our use of the imperfect process we have, because we can test more people today than we're doing. We still need to do better. I completely agree with you. but we have the ability to meet more need than we're meeting right now. The specific thing that came out of our call this morning is really working on how do we take this testing operation, and as we start to have areas of density that might have documented exposure, can we use some of that capacity to go into a senior high rise to do some of this? But again, we're still, 240 tests a day is not going to cut it.
It's 82,000.
I can tell you numbers from the county. There have been results received. This was as of last night, 4,508 results received. 2,038 of those were people who gave a Trenton, New Jersey mailing address. So I say it that way because we know all the difficulty of finding who actually lives in the municipality of Trenton. But what we also see, and this speaks to the point of where is it a problem, the rates of positive tests in Trenton are 7 points, 8 points higher than everybody who's gone through the county. So our data show that this is of more concern in Trenton, is happening more in Trenton. There's more of a need in Trenton. And just because a lot of Trenton residents have gone through the Quaker Bridge site does not mean that the needs of Trenton are being met. And that's one of the other conversations that we are, whenever that comes up, it goes, well, Trenton is the single biggest municipality going through the county's testing site. Okay, that does not mean that the needs of Trenton are being met. You're just talking about the size of a city. Come on.
Yes. And we are testing in every ward every week.
Yeah.
So put up the ward concept. We already test in every ward.
Well, we got that, but as Greg pointed out, the numbers are low because people have to go through they have to be symptomatic and they have to be referred by a doctor, and those are two barriers that have slowed down the testing process. And as we've discussed, you got to go to the projects with the van and let people know in advance, a couple of days ahead of time. The van's going to be out there for the COVID test. You need to go out there and get one for you. Bring your babies too, and come on out and get a rapid test. At least and I understand this needs to be follow-up. I understand how that works. But at least at that moment I'm negative or I'm a positive, and you'll be able to find some asymptomatics, and you can start anything close to contact tracing. So until we get to that point, we can have available tests, but if they're not connecting with the people who need the test or who want the test, it's we have capacity, but it's not connecting with the people who need it the most.
There's one other piece of the physician part of this that came up, and this actually came up from Dr. Evans a week or two ago. The role of a physician in this is not just ordering the test. It's also helping the person understand what to do with the result. And I know, Dr. Evans, I don't know if your audio is working or not, but she had shared that.
Can you guys hear me?
Yeah, we can hear you.
Okay.
Yeah. I just, your comment about your experience of delivering the result to patients and then understand, I don't know if you can share that.
Yeah, so, we've been seeing so many patients with testing, either negative or positive results. And what we found is that for a lot of our patients, getting that positive test result feels almost like a cancer diagnosis. We hear so many tragic stories about what happens to families with COVID, that when they hear that information, it's devastating. Many people have mild symptoms. Many people are fine, but it's also an illness that can go on for days and weeks and then turn a corner and someone becomes very ill. So a couple of things we've learned, and this speaks to what you said before about resources. We really, when we schedule somebody for a test, we make sure they have a follow-up appointment, because it's not just a question of positive or negative. It's how do I know if I need to go to the hospital? Who isolates? Who quarantines? Talking a family through something like 2 parents, both with symptoms, 3 kids age 17, 15, and 4, isolating over here. What do the parents do over here to keep their kids safe? They're keeping themselves in the bedroom. What do they do about food? Nobody can work. What do they do about all those basic things? Now they still need to be going to school. They don't want their kids to get in trouble because they're not doing distance learning. So the other thing we found is not only is that appointment so important, but everybody who gets a test result, we have them also do a behavioral health visit. So the other thing that I was hoping you could just help us share, our behavioral health workers are licensed clinical social workers, and they have access to all that digital information that Greg mentioned that the Trenton Health team has done such a good job of pulling together. So if you're a Trenton resident and you are suddenly living with a COVID diagnosis and you're worried about paying the rent, keeping your electricity on, making sure you have enough food, keeping your kids in school, if you have that visit, we can connect you right into those resources and help you talk to the people you need to talk to in real time. And that it doesn't matter if you have access to the internet. We can do telephone visits as well as internet-based visits. So part of the communication we would love to do across the community is just make sure everybody is aware of those resources that do exist. And, you know, as you said, testing is just the first step. After that, there's so much more that comes. When we hear that our testing positivity rate is between 45 and 50%, we know that means 4 or 5 times more people are living with infections than we have the numbers for.
That's
And
right.
so that's just an enormous quantity, enormous number of people in our community that we want to try to spread the word of here are the resources, here's the way to access them. The advantage, and I've seen this in so many different situations, we have a community of a size where there actually are enough resources. Our hospitals, we're in a hot spot, but our hospitals are not overwhelmed. They have the care our community members need, and there are a lot of resources for all those what we call the social determinants of health, helping you with your electricity, helping you with medications. But the knowledge about how to access those is really not always there. And that's another piece that's so important, other than just receiving the result, taking that next step forward.
Excuse me for a moment. There are people who are sending me questions through the chat, and I think we need to include them in the conversation. One person has asked, is there a connection to the Trenton Housing Authority, and how can we get people tested at the Housing Authority?
So yes, it is a connection to the Trenton Housing Authority. I have actually included the president of the Trenton Housing Authority or the director of the Trenton Housing Authority on our daily calls. Right now, they have only had one positive person in the Trenton Housing Authority, and that wasn't even in the high rise. That was more in the townhouse area. So they already are prepared to do testing if an outbreak occurs. So they already have a plan in place, and we've already offered to support them with any means that we can if there's an outbreak in the Trenton Housing Authority. So that's already been addressed.
Well, can we do it before there's an outbreak? I mean, the whole idea is prevention, right? We don't want to have an outbreak. And if we find more symptomatic, because if there's one person, they're going to contact someone else. So if there's one, there needs to be contact tracing, and we need to test the residents there to see the ones who are not symptomatic and the ones who didn't self-report. So the idea is not wait for an outbreak. It's the idea to prevent it before it ever occurs.
Well, I'll submit to you that if you test everybody in the Trenton Housing Authority, there still can be an outbreak.
It could be. I mean,
So testing doesn't prevent an outbreak. What it does is
it does. It can mitigate it.
It doesn't prevent it. It can mitigate it. So
you can prevent it if you stop that one super spreader or that person that's asymptomatic. You can prevent that outbreak because that's the person moving around infecting people and not knowing it. And if you catch them people, yeah, you can prevent an outbreak. Absolutely.
If they follow all the procedures and processes, and we've already seen that that's not happening in the city of Trenton. Mm-hmm. So, and in reference to pre-testing, I would have to talk to Jelani to find out what's his process, because he doesn't come under our mandate. Again, this is a partnership that we have with them, the same way we reach out to the nursing homes to try to make sure we support them in any way possible. So they're funded, I think they're mandated by either the state or the federal government. So he would have to look at his jurisdiction or his governance to see what he's allowed to do in the housing authority.
But I'm just asking, this is a rhetorical question.
Mm-hmm.
They're located in the city of Trenton.
That's correct.
They're going to fall under the city of Trenton health guidelines, rules, department, however you want to determine it. And if the health department says you're a high density area, we need to test your people and make it available to them, whether they're funded by the federal or the state government, that doesn't matter. Jurisdiction still devolves to the health department.
It does matter because where does their mandate come? It's similar to the nursing homes. We can't go in a nursing home and make them do anything. We can make recommendations and we can support that process. And so, for example, with the nursing homes, they don't have to give us the information, but when we heard there was an outbreak, we offered them tests so they can get all their people tested. But they don't have to report to us.
Governor Murphy
They don't
said
have to even accept our tests if they don't want to, but even though they did, our PPE, they didn't have to accept that. They come under the state mandate. So it does matter who the jurisdiction is.
I get that, but Governor Murphy just said today that he's going to test all nursing homes, period.
That's correct.
And
Mr. Ward, we actually talked about that this morning on our daily call with the hospitals and Director Sawyer, and the physicians on the call were all saying, this is great. How's this going to happen? Because the testing capacity needed to do that doesn't exist yet.
And I have a funny follow-up to that.
Go ahead, Dr. Oates.
We got 2 separate calls today from different skilled nursing facilities and assisted living organizations saying, hey, we got a letter from the state saying we need to test all our employees. Can you test all our employees? And so absolutely we agree with that mandate. I think the challenge is putting the mandate before the infrastructure. As you're saying, you need to have that plan in place. And I think we absolutely all recognize we need broader access to testing. We need broader access to the things that happen after testing. Doing a mandate is important, and I love it that we're speaking to that, but then the next piece needs to be having those resources in a line. And because at the Trenton level, we've been seeing the need to really, before anybody talks about opening, really talk about how do we maintain the social distancing we have, which has brought our cases down, brought our death rates down, but not to a point where we can afford to relax anything. And so at the point we're at, we need to, before we move forward, have that expanded access. And then, as you said, have that contact tracing, have the ability to isolate people. We're still hearing from the state that they're maybe setting up a system for contact tracing, but that's again in the theoretical stage. And so just as you said, we're very interested in, well, practically what does that mean? Because of that sort of desire to be proactive, we stood up a shelter for unsheltered community residents who are COVID positive. That's not at maximum capacity either. But to be quite honest, my suspicion is it's partly because we're not testing all of our shelter residents yet. And so we are only testing the ones who are symptomatic.
Well, may I cut to the quick on this? Can I get buy-in that Trenton needs a COVID-19 testing plan? Are we in agreement on that particular point? I mean, is there consensus around that fact?
I think we already have a plan.
You already have a plan.
That's correct.
I think what we're saying is the plan needs to continue to evolve, but what we're
I agree
doing
with that.
is we're trying to make.
That's what I mean, Mr. Sawyer.
No, it's not synonymous. Having a plan, we need to have a plan means you don't have one. Evolving the plan means you have a plan and it's going to grow. So all plans are fluid, especially with this pandemic. This is a fluid pandemic. It changes every day, every week. The information that comes out changes every day, every week. So the plan does have to be fluid and evolve. But when you make the statement that we need to have a plan, that's assuming that we don't have a plan.
You have a
words matter.
Okay, you have
words matter.
I'm asking you straight up. You have a COVID-19 testing plan for all people in Trenton?
Not for all people in Trenton.
Okay, that's what I'm talking about.
We have a testing plan.
You have a testing plan, but it does not include everybody in Trenton.
That's right.
And I think
no, that's not true. It does include everybody in Trenton as long as they have a prescription and they're symptomatic.
When
so
you
we do,
as long as that's not.
So it's not saying, oh, you can't get tested. Everybody in the city of Trenton can get tested. That's why we go to every single ward every single week. Now, do we need to evolve and grow and get to asymptomatic testing? Yes, we do.
Okay.
I agree 100%.
Okay.
We're not there yet.
I know that.
But it's not because we're saying that's not what we want to do. That's not the conversation. We have conversations every single day.
I'm not
saying that we need to prep and get to the point where we have asymptomatic testing.
Do we have a consensus with the people on this call that we need to put together a COVID-19 testing plan for Trenton, however it has to evolve. And I'm thinking that it's, we should identify the priorities, what our needs are, and how we're going to get from A to Z once the resources are available.
I think that's the key point, is that the difficulty in bringing a plan like that to fruition and execution is answering a bunch of those questions on where are we going to get PPE, where's the testing supplies coming from. So I don't think putting out a plan saying we're going to, clearly we want to get to the level of testing that we need, but I think the group that's what I've heard from the healthcare partners and what I've heard from Director Sawyer, this is a very motivated and practical group, and putting out a plan that we know is not going to happen because of all the dependencies that won't get fulfilled doesn't work. We want to make sure what is the next set of barriers? What's the next step in the evolution? What are the barriers, and how do we knock those down? And once we get that set up, we do that again. Like I mentioned, how the walk-up sites in Trenton started in the first place. So right. I think I certainly would agree with you. I'm not a healthcare provider, but we need to get there. I think the next step to get there in this evolution is how do we do focused testing based on contact tracing, where we see there are dense populations that have a higher risk. That's the next step. Beyond that starts to then be, where are the populations that we see still have more prevalence, even if we don't have a specific contact tracing, and then do more testing in those specific areas. And based on the testing we have now, we can tell you where we see, just by zip code, where the rates are higher.
Well, what you're describing is exactly what I'm asking for.
Yeah.
And it seems that this is not a criticism of anyone or what they're doing now. I'm simply saying that without a clear direction, not only can the healthcare providers not get there, the citizens certainly can't, because they don't know where they're going in the broad sense. We don't know because nobody's told us. Now, is just a fact. And as I said, I'm a healthcare professional myself, and I don't know. And above most average people, with due diligence, I can't find that plan. I don't know where it is. You guys could talk about it all day, but if I'm not informed as a resident, it really doesn't, it's not relevant in my life. So what I'm saying is, let us please, the things that you've enunciated to us today, this evening, are all fine, and I don't take issue with anything, but it needs to be organized in such a fashion that it can be communicated effectively to the people who need to know it. And that is what's failing. And then again, I don't see the barriers. I'm trying to look at the goal. There's always going to be barriers, and we're going to have to find a way around each one. But if I spend my time worrying about each barrier that I may encounter, you're never going to get very far at all. You do, I understand there's barriers, but if there's PPE barriers or personnel barriers, let's identify that barrier, work on it, and get around it.